when we suffer from chronic low back pain, nobody necessarily tells us what we should and shouldn't be doing. In this series of videos, I'd like to talk about the mistakes that I've seen people make in my 10 years working as an osteopath. Ultimately, I want you to try to avoid making them so that you can get better quicker. So one of the most common mistakes I see people make is when they think about the anatomy and they worry about deformities, or what would be better called abnormalities, things that aren't quite right. When unfortunately, scans will call normal findings, or what you call coincidental findings, they call them scary names, such as herniations, which is very, very common, such as spondylolisthesis, which about 1 in 9 of us have. These coincidental findings don't necessarily tell you exactly what's causing your pain. They are not the only factor in your pain. So obsessing and thinking about the anatomy after the nasty stuff has been ruled out, nothing sinister has been found, after the checks have been done, is really not very helpful, and it really can hold people back from moving on with their life. Mistake number 2 is related to the mistake number 1, but it's the mislabeling. So, for instance, if somebody says that you should not bend forward because your spine is unstable, cannot handle it, that can do something which is the opposite of a placebo. That can basically mean that we stop moving, we stop using it. And like a self-fulfilling prophecy, that then increases the pain. So us labeling things is a really dangerous thing to do if we get it wrong, because unfortunately many people have been disabled, and I say disabled as in not able to live the life they want to live, because when they have low back pain, because they've been told something, or because they've read something, or because they've seen something that's fostered a belief that stops them from keeping that spine mobile, from keeping that spine as strong as it should be. We must remember that inaccurate anatomical mislabels can often disable. The mistakes to avoid in day-to-day life, again, can be linked to mislabeling. So if we mislabel one thing as being unsafe to do forever, then we will probably try to avoid it and won't do it. And a very common mistake I see people make is they mistakenly think they should never lift. Now, if you were to live a life and not lift, things are going to weaken up, things are going to get tighter, and that then, as we were saying, mistake number 2, can increase the risk of that long-term disability, which can then create a spiral loop, making the pain worse once again. So be very, very careful, and when it comes to saying you should not do something, you should not move in a certain way. Much, much better to be sensible in the short term and constantly reevaluate. If you're in a big flare up, much better to temporarily reduce heavy lifting, avoiding it for a while, then maybe modifying it, tweaking it and adjusting it and getting back to it, rather than to avoid ever lifting. Mistake number 4. We talked about labels and mislabels and the dangers of that, and ultimately there is that danger and there is that risk, which is really where professionals can come into play. So a prime example of a professional with a medical diagnosing a medical problem would be paramedics. Now, a paramedic doesn't necessarily ECG every single patient. They don't necessarily give an MRI to every single patient or CT, go up, ask for a CT scan. What they do is very similar to what osteopaths do. They check if things are functioning. So for instance, somebody's on the floor, non-responsive, they check they're still breathing. They check they're still able, their lungs are still able to work and give them the oxygen they need to live. They check if their heart's functioning. Is the blood being pumped round? So that it's the oxygen getting to all of the joints and muscles and organs. These simple checks are very similar to the checks that osteopaths do. Are the nerves functioning? Are they working? Are the joints moving? Are they working? If they are functioning and things are working, then we can really be very reassured that there is not necessarily anything sinister or nasty going on. This is what we train for 4 years to do. This is what we constantly have to evaluate, double check. Because ultimately, we won't refer or ask for any scans to be done if things aren't working perfectly. Mistake number 5. Nihilism is a term for when we think nothing can be done, so we won't do anything. We give up. Okay? And that's very, very commonly done after we've tried a couple of things. Maybe we tried painkillers. Maybe we tried seeing the doctor. Neither of which helped. We're still in back pain. So we can give up. Now, just because 2 things did not help does not mean that you do not have the power to continue to find something that can help, or some things that can help. There's a big research paper I read not so long ago talking about the different treatments for acute low back pain. I think it was around about 52 different treatments. So if you've tried 2 things, you're missing out on trying 50 different things. So there's nearly always some hope. Okay? Obviously, realistically, especially if you've had back pain for a long time with or without sciatica, it's very unlikely you'll get a quick fix, something that will take all your pain away instantaneously. Okay? Human bodies are complex. Sometimes that can happen. But if you have an expectation that there's something out there that can dial down the pain, make things a little bit more tolerable so you can live a little bit more, then you keep on looking, keep on trying, okay? And yes, there's no guarantee associated with any one thing you try, but the odds are forever in your favour. Mistake number 6 is thinking that the only thing that can help is something super, super extreme, okay? Which is a very common belief, stems from the fact that the pain can be so extreme. So it needs an extreme solution to take one out of that pain. But there's a study in 2009 that ultimately found that risky surgical operations can not necessarily more beneficial for you than what we call conservative treatments, things that carry far less of a risk and are far less costly. So please don't think that the only solution is surgery. And the vast majority of the time, my fellow professionals in the NHS will not recommend a surgery until the conservative things have been tried, until some hands-on therapy has been trialed, some exercise has been tried, time has been respected, Mother Nature, Father Time, and other options have been looked at and eliminated before you go to the extreme stuff. Again, at least another 52 different options out there when it comes to trying something that will help. Now, one of the labels that is very commonly prescribed to people who are over, say, 40 or 50 is osteoarthritis. Now, osteoarthritis can affect the spine just as it can affect your knees and your hips. But labeling it as wear and tear can lead to that, what we call nihilism, where you think that you cannot do anything, you cannot manage this, it's just inevitable, it's wearing out, and the more I use it, the more it's going to wear out. Whereas in reality, using it is absolutely fundamental and key to keeping your spines in good shape. Maturing is natural, and it's a process of using it, because if you don't use it, you will lose the ability to move. Things will stiffen up, things will tighten, and that will often go hand in hand with pain. So yes, the label may well be accurate that you've got some mileage of your spine, but please be mindful that osteoarthritis is not something that is a sentence of inevitable decline which you cannot manage, which you cannot do anything about. It is something that can be managed really effectively, and many millions of people out there are doing that with their spines right as we speak right now. So if you are worried about osteoarthritis, please make sure you try to get some sort of an understanding of it. And Versus Arthritis is quite a good online resource with some online leaflets which will help you to get that understanding of osteoarthritis. Very common mistake is misunderstanding sciatica. Now, sciatica many times is thought of as something that you just live with, something that you've got, and again may need surgery. But it's 90%, that's 90% of the time things improve within 4 to 6 weeks on their own. Okay? And yes, nerves hurt. Nerves can be absolutely agonizing, but it is definitely worthwhile remembering that if it is agonizing pain, does not necessarily mean there's severe damage. The two are not necessarily leveled up and matched. They can be different. So please do remember that sciatica is very common, and that vast majority of the time it does get better on itself. But there are things out there, just as there is for low back pain, which can definitely help you to manage things, speed up and encourage that natural healing process. When it comes to that natural healing process, that takes time. Yes, 4 to 6 weeks is not forever, but it's very rarely going to be an hour, 2 hours, days, especially if you have had that pain for a long time. And just because you don't see any instant results from any treatment, just because it doesn't suddenly get better, doesn't mean you're on that winning path. Okay? And it is important to appreciate that winning path. Small wins matter. And I think especially in the British culture, it's very easy to forget about the small wins and to focus on the losses, the little setbacks, which unfortunately is very, very common. But keeping yourself hopeful that you are capable of getting better, that you're doing the right things to get better, that you're on that steady path to a winning outcome is really important. So do not forget those small wins. Now, we spoke yesterday about setbacks. Okay, very, very common, almost normal, I'd say. Okay, but not necessarily forever. Vast majority of the time, a setback will be temporary. Okay, so if you keep going up, 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 and then you have a setback, you probably will return on that winning path. If you're sensible with what you're doing, if you're on that doing the right things, and you're managing things, you will recover. If you're not sensible, if you're not managing, then that roller coaster can be very steep and very hard to manage, hard to go on an upward path. Whereas if we're what I call steady Eddie, where it's a little bit up, a little bit down, a little bit up, a little bit down, okay, and it's in a tolerable level of what you can manage, when you do get that setback, it will be no failure. Okay, things never generally do all get better with low back pain or sciatica. An extreme mindset is almost a natural response when you're in a lot of pain. There's a couple of reasons for this. One, you're in extreme pain, so Of course, you're going to think that only an extreme thing is happening, or only an extreme treatment can help you. Okay. Another factor is a stress response. When we're in stress response, we can think in black and white, fight or flight. We can think that real extreme things, because ultimately the logical part of our brain from a stress response can be dampened down, and the animalistic, more primitive, for want of a better word, stress response can override our thoughts and decisions and how we feel. But an extreme all or nothing mindset can make it really hard to do that, because we could let do this up and down. Nothing can help me whatsoever. Oh, this will fix me completely and utterly. Was actually that middle ground, that path of moderation is more sustainable, is more realistic, and is far more likely to help you to get better and to avoid extreme reactions. A phrase I heard from a lecturer many, many years ago was, what makes a stress a stress? One does. It's our response to stresses that makes the real difference. So if we respond extremely, it's far more likely to be an extreme stress response that we have. So bearing in mind how we receive information can be really helpful. And if you do find yourself at that point of going into a stress response, something that might help you is pausing, evaluating, breathing, analysing. Have I had a severe injury? Have I damaged something from a massive fall? Have I broken something completely? Okay, no, no. Okay. Are things functioning? Are things working? Which you can do to a certain extent yourself. Are my joints moving? Can I move my back? Can I breathe? If it's functioning, if you haven't severely damaged, bear that in mind. Keep this ticking along. Keep your head on your shoulders, trying to avoid that extreme responses, which can lead many people to self-imposed bed rest, or many people to choosing something extreme, such as extra strong painkillers with side effects, or potentially phoning up a surgeon when surgery could have been avoided. Mistake number 12 is, we talked about that middle path. So a middle path is modifying. So something hurts. You're walking your dog. You walk your dog every day. It becomes really intolerable. What you could, an extreme response would be to stop walking, go to bed, stay in bed. Another extreme response would be to make yourself walk even further, even though you're in excruciating pain during and after that walking. A middle path would be to do the same amount of walk, for instance, but not so hilly. Okay. Another modification, a smart modification, would be to maybe use a little bit of a walking aid temporarily, not necessarily forever, don't worry. These simple modifications, if done at the right time, can really help to dial down that pain, and in the long term it's going to help you to keep a level of fitness, as opposed to the extreme responses that we spoke about. Mistake number 13 is more focused on those solutions. So an extreme solution, as it were, would be, my back really hurts. I need to do targeted exercises all the time on my back. No pain, no gain. Okay. Now, that can be intolerable. That can make things worse and flare things up. So even though you're trying to help yourself, you might actually be doing that that thing that sends you into that yo-yo of a roller coaster. Sometimes even the gentlest of exercises directly at an area that is super sensitive, both in the software and potentially in the hardware, can be too much and not tolerable. So as a general rule, if you're pushing through 5 out of 10 pain continuously, you're maybe feeding into that cycle of pain and feeding it, which is not necessarily the best long-term response. Whereas Another modification, if you will, would be to do indirect rehabilitation, which is something that I did a lot of reading about with regards to chronic shoulder pain. Because ultimately the research for chronic shoulder and the same for the lower back is there's not much difference between doing direct work on your shoulders and general work on your body when it comes to heart and lungs, general strength, muscular endurance, when it comes to chronic pain, which seems a bit crazy, but ultimately we're all unit. We come as a collective being, and the, the spine will influence the shoulder will influence the back, the knee will influence the back. Everything's connected. So if you're doing some exercises in rehab, even though it's good for you on paper, if you're not able to tolerate it, do consider your indirect ways of working your back, such as swimming, such as walking, such as cycling, okay, such as using your shoulders, moving your arms, such as maybe gentle carrying things. All of these will work your back to a low level, but it will also give you the pain reducing effects of general exercise and indirectly work your core, your pelvis, and your low back. Mistake number 14 is that extreme response, which I believe was very, very common 30 years ago. You're in pain, go to bed, rest. Now, short term, absolutely appropriate if you're not well, severely unwell, absolutely appropriate if you've just broken something. You need to protect it. But extended bed rest will mean that you will lose muscle mass far quicker than you could ever think of. Just think of those people who wear a cast, and when they take a cast away, their legs may be a third of the size of the other leg. Losing muscle does not help your low back. Losing strength does not help your low back. Losing flexibility, joint stiffening does not help your low back. And it can go down towards that path of inability, which in low back pain research we call disability. So only if absolutely, utterly necessary should you look at bed rest. And you should try and do as much as you can with some other treatments to try to avoid that. So when it comes to avoiding bed rest, ultimately it's daily activity on a regular basis, which I'm going to call daily movement. Now, daily movement isn't necessarily direct exercises focused on stretching your low back, which has its place, but walking, standing. The Apple Watch has a good little function where it will tell you how long you're standing for in a day. Okay, anything where you're active rather than sedentary, okay, can help to keep your back resilient, can help to keep the muscles fired up, can help keep things moving and functioning. When it comes to keeping things moving, there is painkillers has a role, and it would be neglect of me to not add that into one of the many things that I recommend patients do consider as a treatment option. However, with painkillers, especially the stronger painkillers such as opioids, do have side effects. Okay, and the NHS has some great resources that talks about those risks. So please do try to use them sparingly and only for as little time as needed, and only pick the strong medications if absolutely necessary. And do not just use painkillers. For instance, we spoke about in mistake number 15, we spoke about staying active. So if you were to take painkillers, pair it up with some of the other things that can help your low back pain. Don't find yourself dependent on painkillers because that's a nasty path and it can really lead to a downhill spiral. This one's a little bit linked. Mistake 17 is a little bit linked to osteoarthritis, and that is thinking that age is the only factor. Okay, we are complex, and in something called systems theory, it appreciates that we are more than the sum of our parts. Okay, and thinking that age is the only factor, okay, does not appreciate all of the other factors: sleep, nutrition, stress, inactivity, weakness, past injuries, compensations for other joints, beliefs around the back, belief or lack of belief that what you're doing is going to help, a lack of belief in yourself. These are some of the things that just came from the top of my mind as being factors. Yes, age is a factor. If you're 90 years old, age is going to influence your pain levels more so than if you're 20. But it is not the only factor. There are so many other variables. We are complex human beings. So it's always wiser, in my opinion, to focus on the things that we can change, things that we can modify, and accept that which we cannot change. So mistake 18 is very similar to a mistake that we previously showed, and ultimately it's bed rest slows down the healing process and actually increases the disability risk. And mistake 19 talks about deconditioning. If we rest too much, we will decondition. Now, to say decondition is basically we losing stamina, losing strength, losing fitness. When it starts that slippery slope, it's far harder to go up. So there's a saying, I think, in the stock market when they talk about a bull. So a bull is something where things are going good. So they say a bull goes up the stairs and a bear on a low jumps out the window. So going up the stairs takes time, jumping out a window is pretty quick. It's the same when it comes to fitness. We lose our fitness, unfortunately, far, far quicker than we do gain it. So it is crucial that we try to maintain as much fitness as we can when it comes to our musculoskeletal health, which includes nerves. Now, when it comes to treatment of medication, we spoke about the importance of not relying on painkillers only, for instance. This isn't just true for painkillers. It can be true for other things, such as stretching. If all you do for your back is stretch, then we're missing out on some of the other things that might be able to help. And a multifaceted approach where, for instance, I'm using examples here. If you found stretching to be helpful, and you found heat to be helpful, and you found the occasional paracetamol to be helpful, that three-prong approach, if that works for you, that's going to be far more effective than just relying on the paracetamol. So the vast majority of the time, things can work together, complement one another, a little bit like osteopaths and physiotherapists who I've worked with a long time in the NHS. We can complement one another. We don't necessarily have to be at loggerheads. We don't counteract what we're doing. So do feel free to incorporate some lifestyle changes with some strength changes. In terms of strength training, different mistakes, if you're making multiple mistakes, please try to correct a few of them that I speak about here, rather than thinking I only need to do one thing. Now, with regards to the stress response, okay, we can think only the extreme things can really help and really matter and really make a difference. But very often it's the little things that add up that make the real difference. Little things are far more tolerable, they're far more realistic, they're far less risky. So even if you have done extreme exercises in the past, that doesn't necessarily mean that you should go back to doing extreme exercises if you're at an acute flare-up, if it's intolerable for you at the moment. The priority is to let things settle, keep things moving, keep things going, and only once you're there at a settled position can you then slowly, gradually, sensibly progress. And when it comes to exercise, in both the fitness industry, which I worked with for a long time, and the rehabilitation injury, rehab means return you back to the original state of fitness that you're at. Gradual progression, the law of gradual progression is key. And big extreme exercises are not a gradual approach. And yes, you may well get away with that. Extreme intervention, but it's unlikely to be a sustainable thing to get you from where you are, say D, to where you want to be, say point Z. A sustainable, sensible path that respects and appreciates your limitations is far more likely to get you there. Now, out of the 21 mistakes, vast majority are spoken about in the Low Back Solutions book, which talks about 17 different things that you can do to help your low back pain with or without sciatica. It includes some great infographics, all based on research backed by nice guidelines and World Health Organization. So please do feel free to go onto my Facebook page, East Cornwall Osteopathy, and message if you would like to receive a copy of that book. We're here to help. Hope you found this really helpful. Take care. Bye-bye.